Okay, so now we are going to look at very basic CVS cardiovascular system from physiological point of view, and for the very basic concept about arteries, veins, and venules, their anatomical structures. Because anatomical structure of arteries, veins, and venules are the contributing factor for determining the blood pressure, the heart anatomy, heart physiology, all the concepts about cardiac output, preload, afterload, venous return, venous pooling, and valves in the veins, and how those veins drain blood, how arteries supply blood. All these concepts are related to the basic structure of arteries and veins and venules. So in arteries there is lumen, and then there comes endothelium. From inner to outside, endothelium is for inner, and tunica adventitia is the most outer. So tunica intima and tunica media is middle layer. So let's suppose this is artery, and here it is lumen, and then there is endothelium, and then there is tunica intima, and then there is media, and then comes the adventitia layer. So in this way a whole artery is formed, and these arteries are very important in all the structures, come for blood supplying purpose, for venous drainage purpose, and also arteries have contributing factor for supplying certain things to the tissues and organs. So uh, here comes the okay. Now coming to the veins, veins have three layers like tunics, like arteries, but their walls are thinner. Veins wall have thin structure, thin consistency. They are less muscular. They are more compliant. So easily blood can be pooled there, blood can be accumulated there, and they also relax and accumulate a lot of blood inside them. Clinical chemical released by endotheliums, and veins release nitric oxide which causes relaxation, arteries release nitric oxide which causes calcium mediated vasodilation, and also prostacyclins that causes vasodilation. So what happens when arteries are narrowed and constricted, these substances are released and they cause vasodilation and decrease the blood pressure inside the arteries and veins. Endothelium histology is a single layer specialized squamous cell lining blood vessel. Simple squamous epithelium is present inside endothelium. In veins there is blood pooling. What happens? Pooling means collection of the blood due to gravity or loss of vascular tone, especially in vasodilation. Mainly occurs in the veins and venules, does not happen in arteries. So pooling of the blood does not happen in arteries. Now here you can see the difference between artery and vein. Difference between artery and vein mainly is about the wall. Arteries has thick wall, and the arteries have thick wall, narrow lumen, high pressure, and thick media. Elastic are arteries consistency, while veins are thin, wide, low pressure, thin media, and less elastic. And venous pooling happen in the veins. So these are some of the very concepts about veins, and next video we'll be looking about the cardiac.